Afternoon, everybody. My name is Julia Rousey, and I will be talking about the healthcare system um, and the telecommunication of the healthcare system during COVID-19. So, my topic basically is talking about the digital rhetoric of the healthcare system during COVID-19, looking at the benefits and the struggles that come with that during the pandemic and how healthcare providers learn to adapt to give the best healthcare to their patients through telemedicine. So, first of all, what is telemedicine? Telemedicine is defined as the distribution of health related services and information through electronic information and telecommunicative technologies. It allows for long distance communication between patients and doctors or patient and the doctor's clinic. Some different telemedicine communication apps that I found through my research so far is there's an app called Mend and Simple Practice, which are actually very similar. They have options to where you can download an app on your phone, both for Android and Apple phones, I believe. And through this app, you can not only have an online communication with your doctor, but you can also schedule appointments, um, list symptoms that you have for this appointment to kind of make them aware of what you're experiencing, feeling physically, mentally, depending on what the appointment is made for. Um, and then the last four, ModMed, Cario, Healthcare, Virtual Care Management, and everyone knows Zoom. These are all more desktop. It's not really an app that you can download, where although I'm sure you can find an app somewhere. Most of these are very desktop based and um, are like a screen to screen communication between you and your doctor, talking about um, your mental state, whether it's a therapy session or just another like a follow-up. A lot of doctors use these as follow-ups, um, but during COVID they used it mainly for their like main practices and everything. So some advantages of telemedicine that I found was that the effectiveness of the treatment worked really well. It was the flexibility for for time management, made it a lot easier for patients and doctors to figure out a time to where they can sit down on their computer and schedule a time to where they can meet, whether it's for 5 minutes or an hour, um, just flexibility in time. Lower threshold for contact. So, with patients who were immunocompromised or could not leave their house, this was a good way for doctors to still be able to see their patients even if they can't leave their home, so that they can still keep an eye on them and update their medications or whatever they need just to keep in check. Lack of travel time. So, this obviously saves money on gas, saves money on just traveling in general, saves mileage on your car, just very effective. And the accessibility of mental health care. So, just a whole variety of um, different access that you have to your doctor. Some disadvantages of telemedicine that I ran into were that a lot of healthcare providers didn't know how to use the equipment or like Zoom or Cario or really any of them. So it still currently is taking them some time to adapt to the new technology tools and figure out a way to work for you as well as working for them. Um, and some challenges for patients as well as doctors um, would be a lack of internet. If you're out in like a hick area like where I am, I live out in Amosville and there's no internet out there. Um, Another thing that I ran into was age, like elderly people who don't know how to really even work a phone find it very difficult to um, work a computer or even turn it on. I know that my grandmother had several doctor's appointments that I would have to sit in on because, well, actually for a lot of reasons, but one, because we didn't have any internet, so it was very spotty. Two, because she didn't know how to work a computer, much less work a phone or try. And she didn't even know what a website was until I showed her. And then once we got the screen pulled up, the doctor didn't have their camera on. So a lot of communication that we talked about in class of um, open communication to where you have your camera on, your mics on, so that it makes it easier for both parties. So the doctor didn't have her camera on, so I had to try and communicate through my grandmother to tell her that we need your camera on, we need your mic on as loud as you can. You need to speak up because my grandmother can't hear you. Um, it was a lot of the doctor saying something and then my grandmother saying what and then looking at me and then me having to ask the doctor again and then translate it to my grandmother and then tell it back to the doctor. It was very interesting. Um, and then honestly, just the doctor patient relationship in general is very stressed during this online time because everyone's scared about the pandemic and with COVID and getting sick. And um, I feel like sometimes it's hard to keep a relationship, especially between a doctor and patient online versus in person. Because when you're in person, you're physically there with the person, you can talk to them, relate to them, you can do physical checkups. And with a computer, it's really like, it's not as, relationship wise, it's not all there as it could be if you were in person. And these are my references. Thank you guys for listening.